Hello, my name is Dr. Edward Lewis, and today we will be discussing what diabetes is, its types, and how to manage it effectively. So, what is diabetes? Diabetes is a chronic condition that affects how our body turns food into energy. Okay? It's all about insulin and blood sugar. All right? And there's three types of diabetes. You got type 1, type 2, and gestational diabetes. Okay? All of our bodies have sugar in our bloodstream. And it's very important for the cells to absorb that sugar by the help of what is being released from our pancreas, a hormone called insulin. Insulin will help our cells to absorb that sugar, also known as glucose, and convert it into energy. But when our cells does not have the ability to absorb sugar in our blood, there's a problem. Okay, we end up with a condition called diabetes. All right. The first type is type 1, also known as juvenile diabetes. This one usually occurs in children, adolescents, but it can also occur in adults once they get into their 30s. Okay. So this type is also known as insulin dependent. That's when the pancreas does not produce any insulin at all. And it could be due to an autoimmune disorder. The immune system affects the beta cells in our pancreas, and our pancreas does not have the ability to release insulin. So we become insulin dependent. Okay? We have to go throughout the day to monitor our blood sugar levels using different methods by pricking our finger to check our blood glucose levels. There are blood sugar scanners that you see people wearing now on their arm. They can scan it and it'll give them their blood sugar readings. Okay. But with this type, they have to inject themselves with insulin or use an insulin pump. All right. Because without the insulin, there's going to be an extremely amount of sugar in the bloodstream. And if the body is not getting insulin at all, that can lead to symptoms such as increase in thirst, frequent urination, excessive hunger, unexplained or unintended weight loss, fatigue, and also blurred vision. This condition cannot be reversed. It cannot go back to normal. So someone has to always monitor their blood sugar levels and take their insulin. And they cannot skip any meals. And they must be on an exercise regimen. The next type is type 2. Type 2 is also known as insulin resistant. Okay? That's when we have so much blood sugar in our bloodstream to the point that the pancreas does not produce a significant amount of insulin at all to convert that sugar into energy. And that can result from certain lifestyle or eating habits. It can come from being obese. When someone is obese, they develop fat cells in the body, and those fat cells become resistant to insulin. So what does the body do to the excess amount of sugar? It stores it as fat in certain areas of our body. And also, the sugar known as the glucose molecules can also affect the nerves in our body. So we end up having peripheral nerve damage. It can also affect our cardiovascular system, leading to heart disease, heart attacks, high blood pressure, and strokes. It can also affect our vision, have blurred vision. And it can lead to other symptoms that's similar to type 1, frequent urination, okay, excessive thirst, fatigue, blurred vision. Can type 2 be reversed? It can be prevented, and there's a possibility if it's detected right away, it can be reversed. Changes in our diet, okay, exercising, all right? We gotta watch what we eat. The other type is called gestational diabetes. That usually occurs during pregnancy. All right. Oftentimes, if the woman is overweight during pregnancy, that's when their cells become resistant to insulin and they begin to have this problem, gestational diabetes. Another issue that can occur with this is when the hormones are out of control. The hormones that usually regulates our blood sugar levels to keep it in normal range goes out of control, which causes the women to have a spike in their blood sugar levels. But the good news is, oftentimes after they have that delivery, their blood sugar levels and glucose levels goes back to normal. But they still have to get checked because there's a possibility that they can develop type 2 diabetes later on down the road. It can also affect the baby, where the child can end up becoming a diabetic also. So these are the risk factors. I already mentioned obesity, but it can also occur from lack of exercise. We have to exercise. Without exercise, people, that will slow down our cellular metabolism, our metabolic rate, which will hinder the cells from converting that sugar into energy. So we have to do some sort of physical activity. Genetics are some of the key risk factors. If we have a family history of this condition, diabetes, we must get checked to see if we are at risk for the same condition. And we must increase our knowledge on this condition so that we can be aware we are experiencing any of these symptoms. We can know what is happening in our bodies. So knowledge is power. So know your risks. There are some management strategies. Diet. The key thing is diet. People, there is sugar in everything now. It is in our salad dressings, spaghetti sauces, pizza sauces. There's sugar in our sports drinks, okay? High amount of sugar. We can't be deceived by thinking that just because something is healthy or we found it in the healthy aisle at the grocery store, that it's good for us. We have to look at the sugar. If we see a protein bar or a granola bar that has 20 grams of sugar, but it also has 20 grams of added sugar, that's 40 grams of sugar. That's pretty high. We don't want that. It is best to make our own health bars or granola bars because we can gauge the amount of sugar that we want. We don't want to consume too much sugar. Okay? The starches, such as our pastas, breads, that can convert into sugar in our bodies. So just because something is not sweet, it doesn't mean that it doesn't have sugar in it. It can convert to sugar, such as our starches, our breads, and our pasta. Okay? Exercise. As I mentioned earlier, we must do some form of cardiovascular exercise. That will help increase the mitochondria in our cells that can also break down the sugar molecules and convert it into energy. Medication. If we are diabetic, because it's in our genes based on our family history, we can't go around taking the medication. We have to take the medication because without it, it can lead to various complicated conditions. It can be chronic and it can also be fatal. We must monitor our blood sugar levels, which is crucial. It can be reversed, it can be prevented through lifestyle changes, okay? We must make some changes in our diet, increase our exercise frequency, and go to the doctor. In conclusion, people, diabetes is manageable with the right knowledge and resources. So let's take control of our health and live life to the fullest. I am Dr. Lewis, and thank you for joining me today. Please remember to like, share, and subscribe to our channel. Until next time, remember, your health is your greatest investment.